I'm Congressman Dr. Raul Ruiz and ranking member of the Select Subcommittee on the coronavirus pandemic. When I joined the Select Subcommittee as ranking member last year, I stood ready to take a serious, objective look at our government's response to the COVID-19 pandemic. I knew that evaluating the pandemic's origins, examining our supply chain vulnerabilities, and enhancing our capacity to rapidly developing countermeasures were essential to strengthening our pandemic prevention and preparedness systems so that when future public health threats hit our shores, we can save lives. Instead, over the past 15 months, the Select Subcommittee has become an echo chamber of extreme narratives intended to vilify our nation's public health officials. Rather than tackling forward-looking reforms to strengthen public health data collection, improve future testing and contact tracing capacity, or address the inequities that we laid bare by the pandemic, our majority colleagues have spent time and taxpayer dollars fishing for evidence to back up their most extreme members' claims about Dr. Fauci. That's why today, Select Subcommittee Democrats are releasing a staff report debunking point-by-point Republicans' dangerous narrative that Dr. Fauci somehow funded research that started the COVID-19 pandemic, lied about it, and orchestrated a campaign to cover it up. And to make it absolutely crystal clear, the claim that Dr. Fauci was somehow personally responsible for the creation of the COVID-19 pandemic is completely unsubstantiated. There is absolutely no evidence that the viruses studied under the NIAID grant funding to EcoHealth Alliance sparked the COVID-19 pandemic. And there is no evidence to suggest that Dr. Fauci lied about funding gain-of-function research in Wuhan, China. As today's staff report explains in great detail, Dr. Fauci was unequivocally referencing the regulatory definition for gain-of-function research, the P3CO definition, in his 2021 testimony to the Senate. It is the regulatory definition, not the overly broad definition that the majority has relied upon in their efforts to manufacture catching Dr. Fauci in a lie, that has any legal bearing on the research NIH did or did not fund. Dr. Fauci directly, clearly stated this on the record during his testimony in 2021, and he reiterated it to us during his transcribed interview with the Select Subcommittee in January. And when he says that NIH did not fund gain-of-function research in Wuhan, China, under this definition, the only relevant definition, he is telling the truth. Simply put, there is no reasonable basis for Republicans to claim that Dr. Fauci was in any way responsible for the creation of COVID-19. Dr. Fauci made this clear when he voluntarily sat for a 14-hour closed-door interview with the Select Subcommittee this past January, and he will make it clear again today. And by the conclusions of today's hearing, it is my hope that extreme Republicans will finally put these reckless and baseless claims to rest so that we can get to the real business of putting people over politics and meaningfully preparing for future pandemics. And with that, I'd like to introduce Ranking Member of the Oversight and Accountability Committee, Jamie Raskin.
Thank you, Mr. Chairman. I want to salute you on this fantastic staff report, which has eye-popping findings that debunk what the majority has been saying. It's summer in Washington this week, and we like to say on Capitol Hill, it's not the heat, it's the stupidity. And what's happening with the Republicans on this committee is a case in point. After using the Select Subcommittee as a megaphone for outlandish conspiracy theories, House Republicans have once again found themselves in a situation where their own investigation debunks their extreme political rhetoric. Now, just like the impeachment drive proved that there were no crimes, much less high crimes and misdemeanors committed by the president, this investigation of Dr. Fauci shows that he is an honorable public servant committed to public health, and he is not a comic book supervillain. He did not fund research to create the COVID-19 pandemic. He did not lie to Congress about gain-of-function research in Wuhan, and he did not organize a lab leak suppression campaign to cover his tracks. These are outrageous concoctions, fabrications, and distortions. And today, Dr. Fauci's testimony, alongside the thousands of pages of documents and dozens of hours of closed-door testimony provided to House Republicans as part of this so-called COVID origins investigation, will once again dispel these cartoonish claims and reveal that the people bowing down to a twice impeached, convicted felon who told Americans to inject themselves with bleach want you to believe not only a big political lie, but a big medical lie too now. I again praise the Select Subcommittee Democrats for their excellent work holding this majority accountable to the truth, and all of the facts will indeed be known. And now I'd like to turn it over to Representative Debbie Dingell of Michigan.
Thank you, Jamie. For 15 months, the Select Committee has neglected the job we were given to do, the actual work of preventing and preparing for future pandemics. To lead, instead, what they have done is led a crusade against Dr. Fauci, a public servant who has dedicated his life to advancing science, strengthening public health, and protecting each one of us. And despite his continued voluntary cooperation with the Select Subcommittee's efforts, including his voluntary participation at a 14-hour closed-door deposition interview in January, at which I was there every single minute. Republicans have continued to distort testimony to fan the flames of baseless theories that he caused the COVID-19 pandemic. Fact, that is simply not true. As this morning's Democratic staff report shows, there is not a single shred of evidence provided to the Select Committee that substantiates the extreme allegations that against Dr. Fauci, that he funded research that ultimately caused the COVID-19 pandemic and then orchestrated a suppression to cover it up. He did not. No evidence. Not there. Period. Facts. People don't like facts. I do. And now, despite promising to the American people that we would make progress in getting to the bottom of the pandemic's origins, we're a year and a half into the House Republican majority, and their efforts haven't brought us closer to understanding where this virus actually came from. And I have a lot of questions, just like everybody else. I'm totally open. What happened? Why can't we focus on what happened instead of trying to demonize people who've made great contribution to medicine? And while Republicans have spent their time in taxpayer dollars on this fishing expedition, Democrats have been serious about the actual work of preventing and preparing for future pandemics. In the Energy and Commerce Committee, which I also sit on, Democrats have put forward a comprehensive pandemic all-hazardness and preparedness act proposal that meaningfully implements what we've learned from the COVID-19 pandemic. And we need to do that. It's not, will there be another pandemic? When will there be another pandemic? And what did we learn so we are better prepared? And what worries Republicans have refused to move this robust preparedness legislation. Last month, President Biden's Office of Science and Technology Policy at the White House released strengthened guidelines for research involving pathogens with pandemic potential, striking a thoughtful balance between the importance of safety, which we all want. We know we've got to tighten up standards for research in these labs, and continued scientific progress. You know what worries me the most? Is the lack of public trust and public health. My own state, people aren't getting measles vaccines. People aren't getting vaccines for diseases that were almost eradicated, and they're coming back. We need to be working together. Public trust in public health is the foundation of safety for this country. Political games is destroying that public trust. And as we look to the rest of the Congress, Democrats in the Select Subcommittee and across the caucus will continue to demonstrate the commitment to putting people over politics. Because the best thing we can do is actually make progress to ensure we don't have another pandemic. And I would hope that that is something that we can all agree on in both sides of the aisle. And with this, I'll pass it on to my distinguished colleague and friend, Deborah Ross of the Select Committee.
Well, thank you for the powerful words from my colleagues. Today, our committee will have the opportunity to question Dr. Fauci about the steps he took to keep our country safe during the most dire public health crisis in modern American history. But instead of probing our pandemic response or exploring how we can protect the American people going forward, Republicans have a very different goal. Their objective is not to learn from the last crisis or to prevent the next one. It's to excite their base and defame the reputation of a man who served our country with integrity for more than 50 years. Instead of responsible oversight, the Republican majority continues to push narratives without facts and allegations without evidence. Let's take the claim that Dr. Fauci orchestrated a campaign to suppress the lab leak theory, which Select Subcommittee Democrats thoroughly debunked in today's staff report. Read it. For months, Republicans have argued that Dr. Fauci deliberately campaigned to shift the findings in the proximal origin paper, despite witnesses stating that Dr. Fauci did not contribute meaningfully to any meeting regarding that paper. The paper's own authors even testified that they were not influenced by him. Now let's take the baseless allegation that Dr. Fauci was escorted into the CIA to influence the agency's analysis of the pandemic's origin. Dr. Fauci confirmed in his interview with the subcommittee that he hasn't been to headquarters in 2 decades. Yet this claim still has not been publicly retracted by Select Subcommittee Republicans. More lies. And then let's take the sad fact that Republicans persist in justifying claims from Senator Rand Paul that Dr. Fauci lied about NIAID funding gain-of-function research at Wuhan, when he and other federal scientific officials have made it abundantly clear that this allegation is completely false. As members of Congress, we have a responsibility to be honest and straightforward with the American people, especially about issues of public health and safety. Republican partisan games and dangerous misinformation are undermining confidence in science and public health. And this is driving public trust in our scientists to new lows. It's shameful. If we create false doubt about the integrity of public health researchers today, we can't expect the American people to heed their guidance tomorrow. House Democrats are committed to working in a bipartisan way to meet our public health challenges, but we need a willing partner. It's time for Republicans to stop scapegoating exemplary public servants like Dr. Fauci. It's time for Republicans to stop peddling baseless allegations and false claims that undermine science. It's time for Republicans to stop undercutting the public's faith in life-saving scientific research. Our health and the health of our loved ones are at risk under their watch. Thank you, and now I will turn it over to an outstanding member of the Select Subcommittee, Congressman Robert Garcia.
Well, good morning, everyone, and I know we're going to take some questions in a minute. I'm going to pass it over back to our ranking member, but I wanted just to take us back, which I think is really important, just a couple years ago to what actually was going on in our country. We lost over 1.3 million Americans, the single largest loss of life event in modern American history. The economy was crashing. We were facing a massive recession. Businesses were closing. Schools were closed. Children were having to adjust to this whole entire new environment. And at the same time, we had the President of the United States, Donald Trump, giving out oftentimes horrific and dangerous medical advice, not listening to his advisors, and taking an irresponsible approach working with cities and healthcare systems. Now, I was mayor of a community during that entire time, and I remember how horrific that moment was for all of us. It's important to remember the stakes and the ability of this committee to actually do good work. But instead of focusing on how we make healthcare systems better, on how we improve the process for the next pandemic, because there will be another pandemic, on how we actually learn and work with our school systems to improve our education process during these types of medical emergencies, we have done none of that. Now, for me personally, I take great offense to the attacks on Dr. Fauci and our medical professionals. My mom, who was a healthcare worker, died of COVID during the pandemic. My stepdad also died of COVID during the pandemic. I lost two parents during the COVID pandemic. They would have taken the vaccine in a second if it had been available to them before they passed away. And so the attacks on vaccines, on science, on healthcare, on Dr. Fauci are shameful. We should all be disgusted by it. Dr. Fauci is the closest thing that we had to someone taking heroic actions and giving us good advice and moral clarity during the pandemic. This whole idea that somehow he orchestrated this pandemic, this global conspiracy, is insane. And today, the Democrats on the Select Subcommittee are going to push back on every single lie, on every single untruth, on every single attack on science and the medical community. And I want to also reemphasize what was said earlier by my colleagues. The House Republicans on this committee and former President Donald Trump are currently today causing massive harm to the country. There's less folks getting their vaccines. There's more conspiracies around science, and the attacks are not helping us prepare for the next pandemic. It's incredibly disappointing, but we're going to push back when we go into this committee. And with that, I want to turn this back over to our incredible leader of this committee and our ranking member, Dr. Raul Ruiz.
Thank you, Robert. Any questions? Yes.
During the 14-hour transcribed interview with Fauci, it wasn't just about the origins of COVID. Republicans also criticized him over the handling some of the precautions like masking and the 6-foot social distancing. Those affected businesses, schools, and children. What's your assessment of how Fauci handled those questions in the interview and during?
Well, that's a very important question, and I'm sure it's going to be brought up today. Republicans have really been pushing this narrative that the 6-foot social distancing was arbitrary because Dr. Fauci said it was arbitrary. So let me give it some context. It is very clear and makes common sense, and there are studies showing that this virus was an airborne virus from micro droplets in your mouth, and therefore when you would speak or cough or sneeze, you have micro droplets moving from your mouth into the space. And if people inhaled it, or if those micro droplets got into your eyes, your nose, your mouth, you would get infected with the virus. So clearly, if you're standing a mile away and I'm here, these micro droplets aren't going to reach you. So clearly, social distancing has been a basic, fundamental public health measure to prevent airborne droplets from a person's mouth to infect somebody else. Now, the question was, why 6 feet versus 3 feet versus 10 feet? Now that was arbitrary, because we know that the distance that a microdroplet travels is based on many variables, including the force of ejection from somebody's mouth through cough, sneezing, singing. It's also it could be dependent on, how long it hovers, the wind, etc. So in order to simplify the understanding of social distancing, 6 foot was chosen in order to create that measurement for social distancing that was easy for people to follow. Okay? Okay. Next question. Yes.
Yeah, there's been testimony during the committee about Dr. Fauci's aides avoiding FOIA requests. And I'm wondering, how concerned are you that the institute that he ran, perhaps with his knowledge, avoided Freedom of Information Act requests or took steps to not to comply with
So thank you for that question. One is there's no evidence to suggest that he knew about it. Two, we are very concerned when any administrative employee does not comply with FOIA or tries to bypass it. And we made it very clear during the testimonies of David Morans that is not acceptable. But let's tease out the differences here between the accusations that Dr. Fauci created the virus, that he lied about it, that he suppressed the truth, and that he tried to cover it up, versus an individual who bypassed the FOIA and used his personal emails, and that bad practice that he's going to be held accountable for. So there's two very different subjects, and regarding any individual that will skirt the laws of FOIA, that's very concerning, and they should be held accountable. Yes.
I'm from Politico. Just on this topic, how concerned are you that extends beyond Dr. Morris and Dr. Dasha, whom you agreed with Republicans that should be defunded, and HHS has taken steps towards that? Are you planning to sort of like do an investigation, a NIAID or maybe an NIH, to see if this was more widespread? Leaving aside Dr. Fauci, this was more widespread among people at higher levels?
So those conversations are happening within our committee to determine what would be the next steps. So far, we have no evidence to suggest that it is systematic or that it is a problem throughout NIAID or NIH. And so we have to look at the amount of resources that we have regarding the Select Subcommittee and the prioritizing of the topics that we believe will lead to better prevention and of the next pandemic, or help us be better prepared. For example, focusing on strengthening our data collection within the CDC, focusing on our public health workforce, focusing on supply chain stability, focusing on technologies and equipment and protocols that will allow us to keep schools and businesses open during the next deadly pandemic, so we don't have to face the social isolation that we did during this pandemic. These are real questions that will save lives and improve lives and will prevent catastrophe during the next pandemic. I want to offer my colleagues an opportunity to answer this question as well.
There have been investigations. There have been investigations, and they have not. We, in a very bipartisan way, made it very clear what they had done to people's trust in the system. But there has been no evidence of other wrongdoing, people using personal. They will continue to investigate it. And again, the Select Committee is there, so what do we do to prepare for the next pandemic? I made it very clear towards those that did not comply. But I know there have been investigations. They have not found it. And what we need to be focused on is what do we do? Because I keep telling you, it's not if, it's when the next pandemic comes. So I think we need less of trying to destroy personalities and more how to restore faith in public health and get people to do what they do to prevent it from happening in the future. And you remember, Tony Fauci was using the best science. CDC is the one that did the 6 feet. Everybody was using the best science. When we started this, nobody knew anybody. This was all new. They were using the best science every single day. I mean, one of the things that it did is showed America what had happened is we had offshored everything, and we didn't even have gloves, masks, and gowns in this country and had to rely on China. So we need to we need to talk about pharmaceuticals. We need to talk about our medicines, 80-90% being made in China or India. Is that a national security issue? Yes. Do we need to have an ability to turn a supply chain around quickly and not have to? I was calling people in China as some of my hospitals were making orders there, but you didn't know the quality. Will you go inspect it before we spend millions of dollars? These are the issues we need to be working about, not trying to destroy brilliant men.
Go ahead.
Hey, thanks. So independent of what Republicans claim Fauci did or didn't do, what's your position on gain-of-function research? Again, aside from the veracity of those claims.
Well, currently, under the and this is why it's very important, and I believe that it is the responsibility of the press to also clarify what you mean by gain-of-function research, because this has been a cause of great conspiratorial accusations that are false, regardless of the people making those accusations knowing the true definition of gain-of-function. Now, under the P3CO, it is not allowed to enhance the transmissibility or the pathogenicity of a potential pandemic pathogen, and that is defined by a pathogen that has the capacity of creating great morbidity and mortality. So that's already a that's already been settled. And Dr. Fauci and NIAID did not fund P3CO defined gain-of-function research.
But just to follow up on that briefly, I mean, virologists claim that kind of research does help us prepare against the next pandemic.
So,
speak to that position.
So currently it is not allowed. Yes.
What do you think needs to happen in terms of just accountability for the pandemic in general? Obviously, your definition of it might contrast from Republicans, but does somebody need to be held accountable for either pushing the Wuhan lab leak theory or some of the other actions that were taken in response to the pandemic?
So let's be clear that the lab leak theory is a part of the conspiratorial accusations that we have spent 15 months preparing. The lab leak theory is a possibility. Okay, it is possible that the virus leaked from a lab in Wuhan. It is also still very possible that the virus came from animal transmission, and we don't have that information. So Democrats have always advocated to address both issues, to find forward-looking solutions to prevent a lab leak by fostering lab safety and transparency with an international accord. And we've also advocated to have hearings on how to identify high-risk animal transmission locations, how to have an international cooperative approach to contain the virus at the source. But we have not. And the reason we have not had these hearings that would actually help us prevent and prepare for the next pandemic is because Republicans have focused on proving their theory that Dr. Fauci and Dr. Collins funded the research that created the SARS-CoV-2 virus, and that since it leaked, they were on a massive cover-up operation to suppress the truth and even bribed officials to change their minds. That has been what we have spent 15 months through, and countless of interviews, countless of documents, countless of investigative hours to prove through a confirmation bias. So even though the lab leak theory could still be a possibility, it is delinked from all these other conspiratorial accusations around Dr. Fauci, NIAID, and NIH.
Can I just add one
Yes.
thing, if I could?
Please.
You know, the attempted character assassination of Dr. Fauci is a massive and irrelevant distraction from determining who really is culpable. And I would urge everybody to read Deborah Birx's book. Deborah Birx was Donald Trump's own COVID-19 advisor, who said because of the recklessness and the deliberate indifference of President Trump at the time and the Trump administration, we lost hundreds of thousands of people. That's his own COVID-19 advisor. So we understand that all of this is a sideshow, and perhaps Congresswoman Ross would have something to add to that.
So I would just say this is the same. This is like going Trump 101. When you're at fault, distract people, waste money, waste time, waste lives, trying to point the finger at somebody else. And that is exactly what is going on here. We have decided we're not living with that charade. They are perpetuating a charade. Yes, we have actually found some bipartisan work and made sure that people who have abused their positions or government dollars are not going to be able to do that again and going to be held to account. But that is a minute amount of what we've been spending our time on here. My dad is a doctor. He is astounded that we are not talking about public health and how to make people safer and how to make sure all of our research is done in an appropriate way. That's what we should be doing in a bipartisan way rather than witch hunts.
I think we're going to end the press conference at this point. If you have any questions, you can approach the individual members, and if they have time, they can answer those questions. Thank you very much.